Sylvana Sinha, Praava Health founder and CEO. Welcome to today's Facebook Live. I'm very excited today to introduce Professor Dr. Tarek Alam, head of the Department of Medicine at Bangladesh Medical College and visiting consultant of internal and respiratory medicine at Praava Health. Assalamu alaikum, Dr. Tarek. Thank you for joining us.
Thank you. You're welcome. How are you?
I'm good, thank you. How are you doing today?
I'm fine. A little bit tired, but I'm fine.
I know it's the end of the day. It's the end of the day, but hopefully we have a lot of people joining us at the beginning of the weekend. Aজকে আমরা will be continuing the conversation we had from the last live session. যেখানে আপনি COVID-19 pandemic discuss করেছেন আমাদের সাথে। আপনার latest treatment protocol to fight the virus আর প্রাভার কাজ এই সময়তে।
Right.
প্রথমে আপনি একটু প্লিজ আমাদের সাথে শেয়ার করেন আপনার কি perspective on the pandemic in Bangladesh today.
It's a difficult question to say actually. The numbers are different, but what we see is totally different. The pandemic actually hadn't died down. It's still going on, and in the middle of everything now, I think we are having the second wave. Suddenly, in the last 7 or 10 days, we're seeing a lots of patients everywhere. We are hearing about lots of patients being positive suddenly, and these are mainly young people who have been shut down, locked down, and stayed away from classes. I think lots of people are getting out. I think that's the reason. That's the reason the second wave. I think the second wave has begun in Dhaka, especially Dhaka.
So হঠাৎ করে, why do you think all of a sudden this has been inspired just in the last 2 weeks time?
And actually, the cases were slowly decreasing everywhere. The hospitals were almost getting empty. The big hospitals, the government hospitals, the private hospitals. But I think this is because of not being aware, not following the physical distance, not wearing the mask properly, not having that social awareness what we should have. That this thing hasn't gone away. I think that's the main problem. That's why suddenly the surge of cases.
Specifically young people are মধ্যে. That's very interesting to hear that you feel the young people is where it is spreading. আপনার মনে হয় মানে young peopleরা আমার ধারণা অনেক young people মনে করে যে ওনারা আসলে affect হবে না মানে ওনাদের they won't be able to experience the terrible condition that they believe elderly people are much higher at risk. Is that a fair assumption, or can you speak to that?
I think this has been misinformation actually from the beginning, from the start, that babies or young people don't get affected. From China, that's what they said in Wuhan. Then also from the European countries, the young people were not being affected. People more than 40, 45, and people with comorbidities like diabetes, hypertension were getting affected more. So this thing actually has been in the media for the last 6 months. So that's why I think the young people think that even if they get it, that would be mild. But now there was a very recent article that babies, young children, actually they get affected a lot, and they are actually the spreaders. They're spreading in the family. Okay, so I mean, maybe then the thing doesn't get serious because of the vaccinations they get and the immunity they have in the beginning, which wanes down as we get old. But they spread. They spread a lot.
আমি পড়েছি যে young people দের হয়তো even if ওনাদের symptoms এত বাজে না, the long-term effects are may be worse than we even know yet.
That's right. They are saying that the long-term effects, the doctors are not. I mean, we are not diagnosing them. We are not agreeing with the patients about long-term effects, but they are having long-term effects. So many things we are hearing now that is most likely related to COVID. We don't know. It's going to be a year in November next month.
Right.
The virus started. So it's a very young virus, and so many new things are coming up, and lots of data, and that's being people are going through it, and I mean, every day you find something new on the internet. So that's you keep on reading, then I'm sure you'll know that so many things are related to COVID, and which
Right.
really can happen to anyone.
No, thank you for shedding light on that. I hope that the young people watching will take this to heart that, you know, still important to be very careful. Although you're very young, we don't know the long-term effects. It's very true. Akon, it's been less than a year that this virus has been on Earth to our knowledge, and so there's very little we still know about it. Apneto, you've been working on COVID since the beginning, and you've been experimenting and doing some great work on COVID treatment that's gotten some very positive response. Can you remind us of that for those people who didn't tune into the last session, and share with us a little more about your work?
Oh, actually, my COVID work treatment is with a very cheap medicine, and it was found out in Australia that this medicine worked in the laboratory against the COVID virus. So we tried it in our medical college among 100 patients, and we got extremely good results, and most of them got, none of them got admitted to the hospital, and most of them got negative within 4 to 7 days. So that was the beginning, and that's how it came out in the media that this can work in Bangladesh
Mhm.
rather than the big guns, which are expensive. So uh, I'm still working on it. As people are still getting it, there is some modifications of the dosage, and I'm doing a trial. I've got the permission. We started the trial in Bangladesh Medical College and Uttaradhanik, which is a part of Bangladesh Medical. I mean, it's a sister concern of Bangladesh Medical College. So, so hopefully, when we finish by December, we'll get some positive results whether this is working. And there are lots of research going on in ivermectin. The
Mhm.
FDA has approved trials on with ivermectin, and I think there's a lot of pressure actually from the big pharmaceuticals because this is cheap medication, and for there has been a lot of research on new medications on viruses. So I think that's why ivermectin got on the track a little bit late, but I'm sure it's catching up. It's catching up in the Western world, and people will start using it also.
That's wonderful. We're so proud to be part of your journey at Prava, and that, one of our renowned doctors here in Bangladesh is doing such great work. Honestly, thank you for sharing that with us.
Well,
Can you share a little more? What is the success rate you're seeing so far? I know it's still not a complete study, but can you share much about that with us?
the study results actually I can't share with you. I
Okay,
can't share publicly,
sure.
and we haven't started the analyzing yet. It has to finish first. But otherwise, the treatment usually the people I give about 95% they get better. They don't have to go to the hospital, and 5% anywhere in any treatment, even with vaccines, you will have failure. So 5%
Right,
patients end up in the hospital,
sure.
and the mortality rate with ivermectin is really low. If once people take ivermectin, and even if they end up in the ICU, the mortality rate is much less than other patients.
You have some fans here. We have a comment from someone in Facebook. Dr. Tarek Alam is the best. So you have some
Thank you
fans
very much.
tuning in. I think we all agree with that, actually. I would just ask you, is it a good idea for patients who think they have COVID to go ahead and start taking medication for what they believe will be treating it? Because I do understand there are many people doing that right now in Bangladesh.
That has been something that I have been saying from the beginning, that get tested first. Because if you don't get tested, you don't know whether you have it. And taking the medication without knowing, then you don't know whether you're spreading, whether you need to be isolated or not. You have a false sense of security that I'm taking the medication, and you're not affected at that time. And then after 1 month, you get affected. And at that time, you don't take the medication again, and you don't get tested. So there is a good possibility that you might be spreading, you might be a mighty spreader in the society. Okay, so it's better that you always get tested. Go to a doctor. If the doctor knows best, it could be something else. It could be pneumonia, and in that case, the COVID medication will not help, and you will end up dead. So it's always
Right,
better to get tested and to see a doctor.
right. So how do you know if it's appropriate to go and get tested?
When you have the symptoms, everyone knows the symptom nowadays. We have a low-grade fever, coughing, body ache. It could be dengue also. Dengue's cases are coming up slowly. Although I think the government has done a good work this time. We haven't seen that many cases yet. But uh, if you have these kind of symptoms, common cold-like symptoms, flu-like symptoms, then it's better to go and get tested.
Mhm. No, thank you. It's a good reminder for all of us. I do think that a lot of people are getting a bit relaxed. So we do need to all remember if we see any symptoms, we should make sure to go and get tested as soon as possible. Um, there are many countries across the world that are experiencing second and even third waves by now. How long do you think that COVID will persist in Bangladesh at the current rate based on what you're seeing?
The way we are moving around is going to persist forever because we are not doing anything. It actually depends on the what do you say, the people of the land. How the government cannot control you with curfew and all these things because you have to go out, you have to have your livelihood, you have to have a life certainly, but you have to follow the rules for not spreading, rules for not getting infected. Okay, so those things we are not following at all. Someone has questioned that why the government is not taking action on people who are not wearing a mask and there is no regulations. There are regulations. Everyone knows, and there are billboards. There, whenever you call someone, the phone says what to do: wash your hands, wear a mask. But we are not doing it actually, and it's not possible for the government to follow everyone and say, but it's our duty actually. We should be aware. We should be more aware, wear our masks. The problem is, people ask me that, Dr. Alam, why you're not seeing patients in the chamber now? It's not for me because the problem is most of the COVID patients come to me, and if I go and see patients in the chamber, if I'm not doing live, I'm not doing teleconference. The COVID patients will come and sit between normal patients, and again the
Exactly.
normal patients will be infected. So this awareness is not there. People don't give a damn. I'm infected, so I have to go to the hospital. So those things actually really bother me. I really feel bad that this kind of mentality we shouldn't be having that. We should be sympathetic to others. We should know that if we stop the infection here, it stops there. It doesn't get spread. It doesn't go anywhere. So that those things actually should come into our mind more. That I am not going to spread it. I should, if I have to be quarantined, I should be quarantined. If I should be isolated, I should be isolated. So I think more social awareness is needed.
Right. No, it's very sobering to hear you say that you think at the current rate it's never going to go away. What about vaccine development? We're hearing a lot in the international press about vaccine development. What's your view on that?
The influenza pandemic was in 1918 to 1920. So it was 2 years and 50 million people died. And at that time, science was not that advanced. And
Mhm.
after 20 years, the influenza vaccine came in 1940. By that time, 50 million people had died due to a pandemic. The thing is, now everything is advanced, but the thing is, the phase 3 trial on human beings, that takes at least 2 to 3 years for any medication. And to fast track
Right,
a vaccine, and you don't know how a human is going to react. And already 3 or 4 phase 2 or phase 3 trials have been stopped because of side effects.
right.
And
Just this week, Johnson and Johnson had
that's
one,
right.
right?
And who would like to be a side effect patient? Okay, a side effect volunteer. No one would like to be that because whatever is happening, it's a virus, it's an inactivated virus, and it is going. It can do anything it wants. It can kill you. So it's better to wait actually for a vaccine. It's better to wait, let it come, let them really check it out whether it's working or not. Because we have made vaccines, mumps, measles, rubella, hepatitis B, C, all vaccines we're making. So I think we need to give it some time. And in the meantime, we should be health conscious
Right.
and wait.
Yeah, I was reading something recently that was saying that, even if a vaccine finishes its trial quickly, it takes time to manufacture and distribute those vaccines. And even
Exactly.
the largest manufacturer in the world I think, is Merck, and they apparently in every year they manufacture 1.2 billion vaccines. And then you have the second largest manufacturer, which is Sanofi, which manufactures 1 billion vaccines per year. So even if they stopped manufacturing all the other vaccines that they were manufacturing and
That's right.
devoted to COVID, they wouldn't be able to produce enough for the world in 1 year.
That's
So
right.
it's going to take time. It's going to take a
Even
long time.
even if it is ready, it's going to take time for us to get it.
Right. So we have to do what we can to protect ourselves. What I keep saying is we can only protect ourselves, our family members, our loved ones, but you're doing wonderful work trying to help raise awareness. We're all here to try to really encourage our patients, and everyone tuning in, to protect yourselves. We have a question here from Mr. Muhammad Moeen. What are the medicines or vitamins to stay safe and boost immunity?
Well, I'm sure everyone knows about this now. Everyone is having vitamin D, vitamin C, and zinc. But I think the best thing is to have a lot of sunshine. Okay, you need some sunshine. That really helps.
Hmm.
And the people, the low-income group in Bangladesh, the who pull the rickshaws, the ferrywalas, the people who are selling on the footpaths, the shop footpath owners' shops, they don't have that much of COVID, but you see their mask hanging around below their chin, but they don't have COVID. I don't see them ending up in any medical colleges or coming to the outpatient department with these kind of symptoms. But they have a lot of sunshine. They're exposed to a lot of sun. And I think vitamin D,
Interesting.
for me, I think it's a vitamin D is a crucial factor. You can have vitamin C, you can have zinc, but that is deficient in Bangladeshi diet. We don't take
Hmm.
lots of citrus fruits in the lower income group or zinc containing red meat. Okay, but we have a lot of vitamin D in our skin because of the sunshine. I think that is the most crucial fact. For me,
Hmm.
at this moment, I think vitamin D is a big, big factor for your immunity against COVID.
That's very helpful. I've been taking extra vitamin D since the beginning, actually, listening to your advice and others. I think that's a great suggestion. But being in the sun that's really interesting. That's wonderful if we can do that just by going outside.
That's
Um,
right.
how do you think the treatment protocols that you have been experimenting with and others can help us to fight a second wave, or can they?
Fighting the second wave is certainly again it's prevention. You have to prevent it.
Okay.
You have to prevent people from going out. You have to people. I mean people not from going out. You have to prevent them from spreading it. You have to make sure that they wear the mask. They have a safe physical distance. If they're coughing, they don't go out. And the medications actually they cannot prevent the second wave. The second wave
Mhm.
has to be prevented by social awareness. And maybe I think if it really is needed, then again we might have another few lockdowns. But that
Mhm.
I don't think the government can afford to do it. Okay. And recently, the study that they said that people from some slum areas are having herd immunity. So that that again you have to wait for herd immunity because you have to have 70% of people affected. So in that case, some more lives have to be lost also again, okay, to
Right.
have herd immunity.
What's your
But
view on herd immunity generally?
you need to have 70% people infected in any population to have herd immunity. But I don't know about COVID actually. No one knows about COVID, whether it's going to give herd immunity because people are having second and some people had third infections with COVID. Okay.
Mhm.
We are having cases. So COVID doesn't give you immunity that's lifelong or something like that. Okay, so I already had two, three patients who had the second infection in 3 months, and I had
Mhm.
about three patients from some other colleagues that who had a third infection. So it's very difficult to say when the vaccine whether it will work or not.
We have a question from Miss Vivian Panto. Will cold weather increase the chance of the outbreak of COVID-19?
People huddle in the cold weather. People stay together. Okay, so staying indoors, more indoors, there is a possibility that can increase the rate of infection. It can make the pandemic worse, especially in the Western countries. Maybe not that much in Bangladesh, but still there's a possibility that in the cold weather, as we stay home, stay indoors, and there's a good possibility that we might be coughing on each other. So very so close, so that can increase. Certainly, it can
So,
increase COVID.
so another follow-up question to that from Miss Nashiba Akhtar. What precautions can we take during the winter season? Are there
Because
special precautions that are different than during regular times?
now, actually, usually in Bangladesh, we're not that aware about vaccinations. But here, this year, we usually are asking people to take the influenza vaccine and the pneumonia vaccine. Okay,
Mhm.
and extra dose of vitamin D. So maybe that could be a helpful thing because that's suggestions from the Western scientists also and the doctors also that taking a vaccine for influenza might give you cross immunity from COVID because that's a virus also, and it might boost your immune cells, the memory cells that might help you from getting COVID. And getting a pneumonia vaccine will help prevent secondary pneumonia you get after a flu infection that kills most of the people. So those
Mhm.
two things with a little bit of vitamin D that might help. That might help.
That's very helpful. And we at Prava actually are administering the flu and pneumonia vaccine. And I think we currently have a promotion for home sample administration of those vaccines, if anyone is interested. One other question, following up on your previous comment on the vitamin D and the importance of taking vitamin D supplements. Miss Nabila Reza says, we took a we took an 8-week course of vitamin D, 40,000 IU per week. About 4 months have passed since we completed our course. Should we start taking vitamin D supplements again? If yes, what would be the dosage?
Okay, in that case, as you have taken 40,000 units of 8-week course, it's better to check your vitamin D level. Okay, because vitamin D level, there's a reference range between 30 to 100. If it is more than 100, you can have toxicities like hypercalcemia, which can give rise to stones in the kidneys. Okay, so it's better that you check before we start. If it is between 30 and 100, then 60 I think is a good range, which is a safe range that you should have during the pandemic. So it's better to check your vitamin D before you again start the mega doses.
Thank you. Hopefully, Miss Nabila, that answered your question on that. Um, as you know, we are at Brava also doing COVID testing and have been trying to help people, get tested without the risk of going out. If your patient tests positive for COVID, what do you recommend they share with their friends and family to prevent spread of the virus?
If my patients test positive, the first thing they should isolate themselves. They should
Hmm.
stay home. They should inform their employer if they're working or their school or college, and that's the most important thing. And the other thing is they should start the vitamins, vitamin D, C, zinc, and there are few tests that should be done after if you become positive, and keep an eye on your oxygen. You get an oxygen monitoring thing. So you monitor your oxygen, and if you are having shortness of breath, if your oxygen is going down less than 93%, then you should be having oxygen either at home or in the hospital. It's better to be in the hospital. And the 3 or 4 blood tests that should be done after getting positive, that you should discuss with the doctor. That is very important. So those indicate whether you're going to get a bad COVID or not.
And I think it's also important if you do test positive to inform everyone you have been close to that you have
That's right.
tested positive
That's right. That's right.
because they may be spreading it also. They may
That's
have
right.
contracted it and might be spreading it also. We have a question about the flu vaccine. Mishu Zaman asks, should one take influenza vaccine, especially those who've never taken influenza vaccine before?
Yes, yes. Everyone should.
What about children and elderly? Is there any risk associated with that?
No, no risk.
Wonderful. That's very helpful. Thank you. Would welcome any other questions. I think that one question that we had gotten also is, can you please, this is from Mr. Rohanuddin Fahad, please also discuss about post-COVID health issues. What kind of symptoms are you, or lingering issues are you seeing from patients who have recovered from COVID?
Number one is weakness. Weakness is the number one complaint from patients, that they really feel very weak, can't get up from bed. Then there are skin problems. Then there are memory problems. People are forgetting things. Then there are problem with the smell. Sometimes they takes a long time, about 4 to 6 weeks, for the smell to get back, the taste to get back. And there is the main issue is depression. Lots of people get COVID-related depression. Okay,
Really?
yes. So and but the weakness, physical weakness, is the most important thing to say. And if there is lung involvement, then there is shortness of breath on exertion. This thing takes a long time to go, and sometimes if without medication, there are some medications to give the patients if they have this problem. If they don't, if they're not taking it, then it's probably going to be permanent. Okay, so I think it's always better to go to a doctor who will check you out.
No, absolutely. I completely agree. And I think even people, I see a lot of people on Facebook groups posting their symptoms, asking the public at large for advice. And it does concern me actually, because many people are getting their advice in these ways. So the best thing to do is definitely to consult a doctor. Of course, Dr. Tarek is here, but we have many doctors at Praava and across the country who are available to answer your questions. You can call Praava's 10648 line actually and talk to a doctor on our hotline at any moment. We're wondering if we have any more questions. I don't think we do, although you continue to have a lot of fans, Dr. Tarek. Many people saying you're the best, so proud of you, you're a very good man. So, we're very grateful to have you here with us. Is there anything else you'd like to share with us today while you have this forum?
Well, there is a question from, I think, Dr. Paramita Karim. She is
Oh, okay.
asking that once
Sorry,
the
I might
patient
have
has
missed it.
recovered, once the patient has recovered from COVID, should they do a chest X-ray or perhaps a CT chest to look for lung damage? Actually, it's better to do a CT chest, certainly, but if it's for financial restraints, financial problem, at least it's better to do a chest X-ray to make sure that there are no fibrosis or anything that's happening. But a
And that's
CT chest
after
is
you've
certainly help.
recovered from
That's
COVID.
right. That's right.
And that's for anyone who has recovered, who tested positive and has recovered.
That's right. If you can, it's better to do. But otherwise, I mean,
Sure.
sorry, who recovered from COVID with respiratory problem. If you don't have
Right.
respiratory problem, you don't need to do it.
Got it. Okay. Mr. Azman Nabil is asking if there's any possibility of second time infection.
We are having cases, yes. Certainly, there is a possibility of secondary infection.
I was reading an article today in the BBC actually that someone who had, it was a 25-year-old young man who had his first time infection, he had very little symptoms and he recovered very quickly. But the second time, he's actually wound up in the hospital on a ventilator and he's been struggling. So it's quite concerning that even, the same person is seeing two different symptom, two different sets of symptoms when he's gotten it twice. So one should not be too arrogant about having had it. Although I know our the United States president um, seems to think he has it and has been going out and about, but we should not follow that example. I would say we don't recommend that. Does it help if you take the flu and pneumonia vaccine? I think Dr. Tariq, you have shared, yes, that it is.
When someone gets zinc and vitamin C overdose, yes, someone can get zinc and vitamin C overdose, but these are water soluble vitamins, and zinc is also water soluble, so it actually gets out with the kidney. So it's very rare to have zinc and vitamin C overdose. And vitamin D is a fat soluble vitamin; it stays in the body, so that can rise to more toxicity.
That's a great question. Thank you, Mr. Mishu. All right, I think we can wrap up for today then. I hope আপনি আবার আসবেন আমাদের সাথে. I think then someone says I love Dr. Tarek Alam, so I think that's a great great comment to end on. We really appreciate your time and your generosity. You're doing such wonderful work for the country and for
Welcome, madam.
all
Thank
of
you
our
very much.
patients.
Thank
And
you
for
very
the
much.
world,
Thanks, Praava.
actually, we hope we can continue to learn from you with the research that you're doing on treatment protocols.
Inshallah.
Thank you so
Thank you.
much. Shawaike, please stay healthy. And we have one last question. I don't know if you have time to answer it.
Yes. In
It-
chest X-ray, it was identified for me that pulmonary inflammatory lesions found in the left side. What should be the course of action for this? I didn't have my CT scan yet. Okay. I don't know how long you're having it, but if it is more than 2 weeks, it's better to have a CT scan now. Okay. So you'll know a baseline picture. You'll have a baseline picture of your chest, and then from there you can follow with a chest X-ray, and then again, if it is not improving, then you can do a CT scan maybe down the line in 6 to 8 weeks, and if needed, they can give you medication for it to improve.
Thank you. Thank you, Mr. Hassan, for your question. Thank you so much again, Dr. Tarek. Honestly, আমরা অনেক grateful. আমরা দোয়া করি যে আপনি আরো ভালো কাজ করতে পারবেন and we'll be able to continue learning from you. সবাইকে আমি just repeat করতে চাই যেটা Dr. Tarek প্রথমের দিকে বললেন যে we all have to protect ourselves and continue to be careful, wear masks, avoid going out. Because the virus is alive and well in Bangladesh and across the world. So please continue to stay safe and healthy.
Thank you. Thank you. Have a
Thank
good
you so
evening.
much.
You're welcome, madam.
Assalamualaikum.
Welcome.
Thank you, Dr. Tariq.